and she finally sent me her resume. It was 3 pages long. So I'm going to be a little brief. I will tell you this, she's an adjunct professor at LaSalle University, and she's currently a consultant for senior citizen homes and so forth. But in 2020, she was named an Outstanding Dietitian of the Year from the Pennsylvania Academy of Nutrition and Dietetics. Now, you may not have heard of that, but the Academy of Nutrition and Dietetics is the world's largest organization of food and nutrition professionals. So we are in for a treat, and I'm not going to elaborate on all her other accolades, but let's present and give a warm welcome to Eileen Chapnick.
Oh, thank you. Shall I stand anywhere special? I'm going to speak very freely, and I really appreciate being invited. And this handout and topic is called vitamins, but I want to back up before I even talk about vitamins and how I came to put this handout together. I visit in Philadelphia 20 senior centers. So these are congregate meal programs. People come for lunch, for bingo. So in 1964, Nutrition for Older Americans Act was passed, and this was to provide meals for senior citizens. No income requirement, just for people 55 and older was the age range. And they found out that people that were coming for the meals really enjoyed it and kept coming. And they started with then bingo and other programs, line dancing, all kinds of things. So all centers in the United States, you know, every county of every state has something called the Area Office on Aging. It's not AAA like, you know, your automobile, but it's an Area Office on Aging. So it's a go-to place. If someone you see thinks, you think they need some help, they're crazy example, like outside in the winter in their bathing suit, I mean, or they're not dressed appropriately, the Area Office on Aging can send someone for an evaluation, and that social worker can assess they might need some help. And one of the stories, and it's from this senior center, the Montgomery County one, that's the one in Montgomery County that's here is in Narberth. It's called New Horizons. The ones in Philadelphia are Philadelphia Corporation on Aging. The ones in Delaware are Delco. I've done programs for all of them, and this handout is actually the same handout I used for Philadelphia Corporation on Aging. Oh, Leah, we want to hear about Rabbi Gary.
No, we're gonna listen to this.
Okay, you can relax. No. So, the Area Office on Aging has senior centers all over, and I was giving a program, and after the program was over, it was all women, and we were sitting around, and this woman said, coming to the senior center has saved my life. She was a widow. Her husband was a doctor, and she was a medical researcher. She was a widow, and she was an only child, and she had no children. She was alone, and she met someone in the elevator of her apartment building, and that person was going to a senior center and said, why don't you come? And it's just eliminating the loneliness of the elderly. It is one of the biggest spirals down for ill health. Staying in your pajamas all day, watching TV. So that is why I really like doing what I do for the Philadelphia Corporation on Aging senior centers, but I've done talks, and I'm very familiar with all the different senior centers. It prevents that loneliness of the elderly. And I think for us being together as a Rotary, or as any group, it just really is self-care, and it's helping ourselves. You see other people, they see you. Before I talk about vitamins, I have another story of, for 26 years, I was a dietitian with Mainline Health Home Care and Hospice. And that's like a visiting nurse, so visiting dietitian. And I will say not all agencies have the full dietitian for the home, the PT, the OT, the ST, speech therapy. But anyway, I saw somebody with diabetes, and she had some losses. She had a stroke. She was a widow, and she could no longer take the stairs. So her bed was in the living room. There was a bathroom on the first floor. And, I went over her meal plan and, what she was eating and how her blood sugar was. And she seemed to understand with good teach back. She could tell me what she was going to eat. Then a week later, the nurse called and said, gee, I thought you went over everything with this woman. And the nurse went and she's having Italian water ice, like that was not sugar-free Italian water ice, and she had diabetes. And I said, well, let me go for authorization. Let me ask for a second nutrition visit with the registered dietitian. So it turns out she had been going to her local senior center, but now with her stroke and being housebound, she could no longer get there. So the story goes on how she was connected, and we got social services to arrange for transportation to go back to the senior center, but she was eating this water ice so that she would have high blood sugars when the nurse would come and take her sugar, basically sabotaging her own care because the nurse was the only one coming. The home care agency was the only people coming to her house. But once she was able to get van transportation, go to the senior center, she had a real purpose. So preventing that, loneliness of the elderly and having a place for them to go. Some of the meal contributions in the city of Philadelphia for these meal programs are 50 cents. The meal costs at least $4, but it's a donation for your self-esteem, not to get something for nothing. So that is what I'm doing now is, as a dietitian, I really enjoy engaging with my senior centers, and it's very interesting because in Philadelphia, and even in Montgomery and Delaware County, however many senior centers they have for the lunches, it's all the same lunch. So, for example, there's senior centers, the same senior center in Chinatown at 10th and Race gets the same food as, we call it SPOAC, South Philadelphia Older Adult Center, SPOAC. So South Philadelphia, and then Martin Luther King Older Adults, they get the same food. So it all has to do with education and understanding everybody else's meals. So I'm happy to have anybody ask me anything in the meantime, but Leah.
Do most of these patients not have family that care for them, where they feel loved?
Well, so I'm talking about two different sets of people. The senior centers, and I did take, field trips with my students, and one was a nursing group, and they said, where does everybody sleep at night? The senior centers are congregate meal sites. You're coming for a program. You're coming for, Narberth has choir if you like to sing. They have a glee club. I mean, they have music. They have lots of things at Narberth. Palm is the one in Ardmore on Ardmore Avenue, positive aging in Lower Merion. So those people, it's a mix. It could be somebody you meet in the mall. The home care people, the same thing, but the clientele that get home care usually are people discharged from the hospital, so they have a medical necessity. So then that's covered by Medicare and secondary for some other services that they might need. So it's really a mix, but you can look around and you do know people that are widowed or have no children, or your children are in California, but just to engage other people, it's really healthy is all I can come up with, really. So I'm glad we're all here together. So even if we live alone, we have another community of people. It really, the kindness goes a long way just to be together. So I have my little handout because this is the same thing I do for Philadelphia Corporation on Aging, and I really wasn't sure what I was getting into. So if this was a college course in nutrition, we would have 6 major nutrients. And I guess you can tell me what they are, but I can tell you too. Oh, thanks. The whole 3-credit course, which would be 15 weeks long, you'd be covering carbohydrate, protein, fat, vitamins, minerals, and water. So you'd cover those 6 things in a 15-week semester. In a basic nutrition course, 3 credits, say at LaSalle, for nurses, for healthcare professionals. So we're just going to talk about vitamins. And there's a classification, fat soluble and water soluble. So this is where there's a layman's magazine, Prevention, and Prevention says the United States has the most expensive urine because we take too much vitamin C, which is water soluble, and we excrete what we don't need. So there is more isn't always better, and we do get our vitamins in our food. So I just thought I'd go through these questions. So do I need a multivitamin? I don't know if people take vitamins. I look at it like an insurance policy. If it's a balanced multivitamin, Centrum Silver, or it's balanced, I think people kind of get into trouble when they start taking individual vitamins and they don't know what they're for, or they take too many. But a basic multivitamin do no harm, and they're pretty safe, you know. Iron is actually a mineral, so sometimes people do need extra iron. It's a mineral, but you would know that if you were anemic, or you know, you were curious, if you were tired and you thought you had anemia. So the names of the fat soluble, the names of the water soluble, and do I need to take a vitamin? It depends. Always a good answer. What about vitamin D? So vitamin D is a fat soluble vitamin, which is different. So I use sunscreen and stay indoors because that's the sunshine vitamin. I would say, you know, check with your healthcare provider, but it is a good idea because we don't get enough sunshine and we use the sunscreen, and there's cloudy days we don't go outside. So it's up to you. But there are, for bone health, it's calcium and vitamin D and phosphorus. Yes.
Is there a certain amount of time that you should be out in the sun that will give you enough that you don't need a supplement?
The books say for Caucasian people, 20 minutes, for black, dark-skinned people, a half an hour. So even through years ago, treatment of children would be like a sun bath. Take the baby's clothes off and put them in a sunny sun porch, you know, making sure they got enough vitamin D. But really, we can get enough vitamin D from being outside. And vitamin D foods, there's not too many, mostly milk and salmon and fish. Another calcium fortified thing. So if it's like cow's milk, I get a lot of questions about that. I don't drink cow's milk. What about these other milks? So for babies, soy milk would be the best profile of nutrition that cow's milk is. But rice milk and almond milk and coconut milk, they're all fortified with calcium. So if that's what you're looking for, those milks have the calcium. But for children, they don't have the protein. The rice milk and almond milk, and I thought almonds, you know, it's like water though. It's like the water from squeezing the almonds. So there's the charts where you can see it a little more easily, but in any event, that's kind of a long answer to a short question. But the third question I've made up is how can I preserve the nutrients in my food? So steamed vegetables in small amounts of water, and I love it when people say, well, I have this idea. And roasting your vegetables, like there's a new trend to put it on a cookie sheet, a baking dish, and roasting your vegetables. So for things like broccoli, the word is massage oil into like the florets of the broccoli or asparagus, and it's really an easy, and my newest thing is parchment paper for easy cleanup, not foil. And my teacher said it's not tin, it's aluminum, so foil. But a baking sheet, you know, we see it different things we go to, like roasted different color peppers. It's a very easy way, and that saves the nutrients. Or if you steam them, there's things like a basket that fits on the top, and I have a thing that has like, I can make spaghetti on the bottom and the steaming basket's on the top. Or rice cookers have the same affair. A rice cooker has the rice in the bottom, a basket on the top, and you can put vegetables on the top. If you're steaming with water, or even, you know, boiling them, carrots in small amounts of water, the best thing would be to save that water. It's chefs call it pot liquor. It's not alcoholic liquor, but it's something that they never reconstitute rice or reconstitute to make a new soup out of water. It's always water from potatoes or other vegetables. You know, you save that water and then you use that. So small amounts of water. This next question, discuss the food and drug interaction of vitamin K and spinach. It's very confusing, and this is for people mostly on Coumadin. If you think about when vitamin K was discovered, it helps coagulation, and the word coagulation was spelled with a K when it was discovered, so it became vitamin K. So Coumadin is an anticoagulant, so, or we say a blood thinner. So it gets confusing for patients or people, clients, we'd call them in home care. Do I eat spinach? Do I not eat spinach? But carefully reading the package inserts, and most other doctors that we've worked with said, we keep the diet, do what you normally do, and we'll check your blood level, your clotting factor, your INR, we'll check it to see where you're at. But it's a tricky vitamin. My mom was on it, and she was always cold, and she was thin, and then it would be like managing half a pill and a whole, it was a tricky thing to manage. So the things that have vitamin K, there's a lot of them, but they're mostly vegetables, deep green leafy vegetables, and even green tea. So who knew? But if you're always having those things, then that's your medication will be adjusted to always having those things. A very hard concept because people want a guarantee, and I have no guarantees. I can't say. We don't have the vitamin K content, nutrition facts of everything, and we're living life. We're not science projects, you know, we're doing what we normally do. Down at the bottom of this first page is vitamin C in a cold. It really does not prevent a cold, but it makes it a little less severe only by 1 day. So that's where I think people overdo the vitamin C, but do no harm, and it's out there, you know, so it may be to work. If you think it'll work, sometimes that's part of it. The reverse side is a little question about vitamin B12. Discuss. I don't know if anybody wants to read this. I can read it while eating. So vitamin B12 is required in a series of reactions that precede the use of folic acid in the DNA replication. Vitamin B12 and folic acid together manufacture red blood cells. Some persons are at risk of deficiency of vitamin B12 because of stomach issues, age, or diet. And it is common, we lose our capability to manufacture enough vitamin B12. The people that you might know really have to take vitamin B12 are those that have had gastric bypass because we need it, it's in our stomach. So if you don't have part of your stomach, you don't have that capability. Fortification on a food label. This is nutrition history from 1946 and after World War II. It was evaluated that our soldiers were actually somewhat undernourished or thin. And if you look at pictures, the soldiers were thin. So bread being the staff of life, you'll see it on all your bread and macaroni, even on tasty cakes, enriched. And when it's enriched, it has these things in it: thiamine, riboflavin, niacin, folic acid, and iron. Folic acid was added more recently, but thiamine is the, I don't want to say new name, but it's the name we use now for vitamin B1. The nutrition science wasn't always, it's evolving, everything is evolving. So thiamine is B1, riboflavin is B2, but now we have a more scientific name. So when something is enriched, it has that in it. So that's why some people, they kind of say this advice, don't eat anything that has a long list of ingredients. But by law, it's going to have, when it says flour, in parentheses, it's going to say these things that it's enriched with, because that's United States guidelines. If we get macaroni from Italy, it might not be, but that's just information. The next question is, our menu does not need to meet 1/3 RDA for vitamin A daily. Why? So this has all got to do with the funding and this, you know, pretending you're an audience, that it's a senior center and you've gotten this meal. It is 1/3 the recommended daily allowance. That's actually been changed, called the recommended daily intake, but it's lunch, so it's 1/3 of your day. But why don't we have to have that every single day? Vitamin A. So the riddle is, did you ever see a rabbit wearing glasses? Because what's vitamin A for? Your eyes. So, preventing night blindness. So carrots, rabbits eat a lot of carrots. Anything deep orange is high in vitamin A. And anything deep green is vitamin A too, but the chlorophyll masks the carotene or the orange. So like collard greens and spinach would have high vitamin A. But when we have 1/3 the RDA to get funding, it's 1/3 the RDA for the calories, the protein, the vitamin A, vitamin C, low in sodium. But every day it doesn't have to meet the vitamin A. So the answer is vitamin A is a fat-soluble vitamin is stored. That J is a typographical error. The vitamin A intake is averaged for the week and is adequate. So the menus don't always have carrots, sweet potatoes, apricots, or apricots and that kind of stuff. So they have other kinds of things. Just a nutritional curiosity. But it is very interesting hearing about the menu, for me at least. What are some food sources of vitamin C besides orange juice? And Consumer Report did have a statement about the biggest intake of vitamin C in the United States. I was surprised. Potatoes in the form of French fries. Potatoes are very high in vitamin C. They're very high in potassium. So people try to have more potassium and they say, oh, the bananas are all speckly. I'm not buying the bananas, because there's more foods for, potassium is a different topic, but there's more foods than bananas for potassium, and there's more foods than vitamin C for vitamin C than orange juice. But potatoes are a real warehouse of nutrition. So cooking them or baking them, we say in the jacket, cooking them in their jackets saves all the nutrients. Some people say, oh, that's the most nutritious part is the skin. I think it's just the fiber. But washing them well, you trust eating them at home. People may not choose to eat the skin at a restaurant if they don't trust the washing of the skins. So we're covering everything, soup to nuts.
A question,
Yes.
how do you feel about eggs?
How do I feel about eggs? They're on the good list now. They used to be on the bad list. We don't actually like to say, as dietitians, we don't like to say good and bad. It's some kind of shaming or some kind of psychology, I guess. The cholesterol that was analyzed was outside the human body, but we don't have the ability to absorb that cholesterol because of the lecithin in the yolk. So the yolk is where the cholesterol is. So the Heart Association is saying basically, 7 eggs a week. They used to say 3 a week, 3 egg yolks, even that used in cooking. So that's really keeping track. The equivalent of using 2 egg whites for 1 whole egg, you can do in cooking. So I personally, have it as a normal thing. They used to be a real good economical thing, but now they're coming down. So, but a balanced diet is probably where, we want to think about, unless we have a medical need to watch salt, watch fat, watch calories, but we're living life. So dietitians, we say all foods can fit. We have to know common sense, There's something called the DASH diet, dietary approaches to stop hypertension. So that whole research with the DASH diet is really the old-fashioned food groups. More fruits and more vegetables, and watch the way we cook our foods. So I'm happy to have any other thoughts about any questions. Yes?
Any comments you want to make about the Mediterranean diet?
Go for it. I think the Mediterranean diet is wonderful. It's real, it's realistic, and it addresses alcohol in moderation, because that's a very common thing, and it addresses exercise. And that is really one of the main things that we have to build in with fitness and health is exercise. But the Mediterranean diet is a great great model. Gives us good ideas. Yes, Sherman.
Couple quick comments.
Yes, please.
Thank you very much. This is such valuable information to give people. Couple of brief comments, so try to keep them brief.
Yes.
It's so important. First of all, most people that live in the North American continent, unless they work outside, have low vitamin D. So for most people, if they're not having lab work done regularly, it's good to take vitamin D or D3. Because you need D3,
Yeah.
you need calcium, you need some exercise in order to absorb calcium and keep your bones strong, to keep you getting fractures. Very important.
I support that totally,
I
thank
think-
you.
Billions of people, billions of dollars are wasted on all these multivitamins and supplements. You can see all these commercials on television, or radio, or in print. This vitamin's good for this, that's good for that, this supplement's good for that. Of course they're all good for something, but you don't need them. Why don't you need them if you eat a half-balanced diet? You don't need the majority of those things. You don't need most of them. How do you know if you really need anything or not? Don't read advertisements. Get a blood test once or twice a year. If you're deficient in something,
Yeah.
then you take a supplement for it. You just don't take vitamins and this pill and that pill, everything. When people are shopping for vitamins, you're throwing your money away. What you're doing is giving your toilet high nutrition.
Yeah, yeah, that is very important, the vitamin D. We are as a population, yeah.
Get a blood test, go to your doctor and get, I get it twice a year. At least once a year, get a good physical exam
Yeah.
and a good battery of blood tests, including all the vitamins. It'll tell you if you're low D3.
Yeah, yeah,
It'll tell you if you're low calcium.
Yes.
It'll tell you if you're low anything.
Right.
If you don't have an abnormal blood test, too high or too low, anything, don't waste your money. You're throwing away your money. You're thinking you're doing something for yourself. You feel better about throwing your money away. Be sensible about it. It's a waste of money in most cases. Finally, just in general diet, all the authorities will tell you the Mediterranean diet is the people who live longest in the world, the people that are on the type of Mediterranean diet. Fresh vegetables, moderate fruits, not too much fruit. Why? Too much sugar. Fruit has a lot of sugar. That's the bad thing about orange juice. My mother used to make us drink orange juice every morning.
Yeah.
You know what? Orange juice has so much sugar, it could kill you. I mean, it's not gonna kill you, but I mean, it'll raise your blood sugar very high. It's better to eat one whole orange. You'll
Your
get the sugar of one
Tropicana.
orange, not 7 or 8 oranges, and you'll get more fiber.
Tropicana is losing money because people are
Well,
hearing.
they're learning now, all the juices,
Yeah.
look on the label of things that you buy. You see, look at the label of what's in orange juice, it's terrible. Eat an orange, eat an apple, eat a pear, eat a couple pieces of fruit a day, eat fresh vegetables, steam them or
Yes.
don't cook them to death. My mother used to cook vegetables till they were brown, it was terrible. But finally, could you say a word about, but those things are very important, eat less red meat. Red
Yeah.
meat is no good for you. Red meat.
yeah,
And a lot of carbs are no good for you. Carbs, simple carbs, turn right into sugar.
yeah,
You want to get rid of the belly? Cut your carbs in half, or more than half.
Yeah.
Stop eating a lot of red meat on a regular basis.
Yeah.
Bad for you, full of chemicals, full of fat, which clog up your arteries. Most people die from cardiovascular accidents. You want to live longer and be healthier?
Yeah.
Eat a healthy diet and try to exercise regularly. Instead of go to the yard now, I go to the gym several times a week, so at least I'm trying. You can't
Yes.
change your genetics.
Self-care is
But you
not
know your diet.
selfish, it's your-
Finally, would you say
yeah.
a word about antioxidants?
Oh,
What they are
antioxidants,
and why they're important?
yes. So, and then I'll come to Florence, but antioxidants, like anti's against, like antifreeze, so it's gonna make something not freeze. So oxidation means to keep your healthy cells healthy, so you wanna keep your healthy cells healthy and not fall apart like rusting. So that's where the nutrition lesson, eat the rainbow, there's a rainbow on my plate, the children have like, they have 5 colors and you can identify, red, green, yellow, orange, and white foods. White is a little less, cauliflower and different other root vegetables. But the phytochemicals have different properties. The phytochemicals are in different of these colors. So like red has lycopene, so that's helpful in preventing prostate cancer. And there's one in the white ones like the white vegetables like garlic or
Onion.
onion. It's called Allison. It sounds like a girl's name, but that can help lower cholesterol. So they mostly prevent cancer, but they also contain fiber. And you know, one visual is to think of your plate and have half your plate as vegetables, and have the meat or the protein as not a condiment, but just not as the main attraction. And then the starch, whether it's rice or potatoes or pasta or starchy vegetables. The colors are important too. And they have the phytochemicals that help fight cancer.
I wanted to ask, you said the Mediterranean diet is the best.
Mhm.
How does pasta fit into that?
I'm not really sure, probably a small amount. I mean, it's portions. It's like all foods can fit, but how much and how often?
I mean, how beneficial is pasta?
I don't think it's as beneficial as other like potatoes and sweet potatoes, and but it's a good vehicle to, like we say, green up your pasta. Fold in spinach with your pasta, or broccoli with your pasta, or fold in some other vegetables with your pasta. There's a diet from Penn State. It was called volumetrics. Volumetrics. So it was how to eat a lot, but have not a lot of calories. So if you think of a bowl of popcorn, and then you think of something else, the popcorn is light and airy, so you can have a lot of that. And so they have a whole, lesson plan on how you can have volumetrics. But pasta, everything can fit. It's, being true to yourself. Yes, a thought.
Yes, thank you, Eileen, for visiting us
Oh,
today with
you're
your
welcome.
great presentation.
You're welcome.
Speaking of food supplements,
Yeah.
as I look around, I see George. When George and I and Jack and Tom were young boys in the 1940s,
Uh-huh.
we used to see older people walk around town with a big goiter on their neck, which we don't see anymore. Do you remember what changed in our diet back then to get rid of the goiter?
Yes.
Tell us.
Iodine.
Right.
Iodine. The United States had something called the goiter belt. We heard of the Bible Belt in the South, but the goiter belt was vertical, and it was in the landlocked center of the United States where the sea air didn't evaporate and go into the clouds and then rain down and water the crops. So the people in the middle of the United States didn't have enough iodine. So it has to do with your thyroid needs this iodine, and now we have iodized salt. So, but in nutritional history, like Elizabethan times, it would be a status symbol to have a big goiter and then that big collar, and Queen so-and-so, had a big goiter. But yes, it affects your metabolism, but that is a very curious nutritional history thing, how we've learned so much more. But getting back to the middle of the road and the common sense, Yeah, I don't think I've ever seen a person with a goiter in real life, though. Yes?
Why has there been such an explosion in obesity in our country? Have people's eating habits changed that much over the last 40 years?
Well, you've noticed what I've noticed, and I think it's the lack of exercise too, and it's the feeling of privilege or reward. Food is a reward. I used to work with group homes for special needs people, and that was a tough thing. Is like or even regular households. Get an A+ on your report card. We'll go out for ice cream, but associating food and rewards. It's probably very complicated. I think exercise has a lot to do with it. And the parents, single parents, or parents not being the role models because they're too busy to plan, make a grocery list, make a menu, plan a grocery list, have the right foods in the house, and not just, try to scramble around figuring out what's for dinner. It is a problem.
I think it's the ingredients, the processed food,
Yep.
and
Yeah.
the ingredients,
Yeah.
that's what it actually is.
Too many carbs, too many simple carbs, too many calories, sweet stuff, too many desserts.
Yeah,
Make
And
this
portions.
stuff, you lose weight.
Portions.
yes,
But-
It's unbelievable
yeah,
what you get
portions.
served in an American restaurant.
Yeah.
It's unbelievable. And it was when I lived in Germany for 3 years and came back to the United States. I couldn't believe the changes that I had seen in people.
What years? In what years you're talking about?
73, 76.
Because now I don't know if there's much difference between.
Well, that may be, I haven't been back to the war.
So I had dinner
Yes.
by myself a couple weeks ago at Manella's Diner in Wayne, and I saw like ground beef steak, right? 16 ounces.
Wow.
Steak.
And then I asked, is there any smaller version of it? And I heard, no.
That's why
I
they
didn't order.
That's why they have the takeout boxes, cause you only should eat half of what they give you.
Well,
Yeah, that's a good observation. There's a palm of your hand is a suggestion, the deck of cards, 3 ounces. That's the visual we use to teach, heart-healthy meals is that size for your meat. Because all meat is gonna have fat, no matter how lean you can get it.
The chemicals.
Well, the chemicals too, the bone, to make them fatter and more money to be made from them. 16 ounces is quite,
it's absurd.
yeah. That is interesting. And surf and turf, same thing.
There's a restaurant in New Jersey we've been eating at lately because it's close to where my brother's in the rehab center. A place called Radins. They have in New York and here. We ordered a sandwich. There was 1.2 pounds of meat in that sandwich.
Yeah.
Unbelievable.
We're all on the same page here, I can tell. This is definitely wonderful. It's,
Everybody takes it home.
yeah, taking it
Well,
home,
that's what you do.
Unbelievable.
right, yeah, yes.
Speaking of food portions,
Ooh, yes.
last night I had the pleasure of attending Adith Israel's Men's Club annual steak dinner. And they served a T-bone steak that was this big. And we had small potatoes, and we had fried onions and fried mushrooms. And I ate the whole thing. Beverly only ate 2/3.
There it is.
And I ate her remainder.
And you're still standing.
Yes.
But you're not gonna eat steak the rest of the month, right?
Right,
Correct.
these are common sense, and we are our own best advocate for ourselves, that we have to really think about this. So this is,
Thank you very much.
Thank you.
Thank you. And are there any other questions?
This is
before we
fine.
end?
oh, thank you everyone, you're so welcome. Thank you.